Hi, everyone. Just a disclaimer, I'm absolutely honoured to be here. I'm actually a radiation therapist by background, so thank you for having me. So Genesis Care. So Genesis Care is one of the leading private radiation oncology providers in Australia. We treat over 30,000 patients a year across 50 locations. We mainly provide radiation oncology services, and we have a growing market in medical oncology, theranostics, and precision medicine. So you're probably wondering why Campbelltown for us. So Campbelltown, basically we saw that it was a population growth in the next 10 years, it's going to double. We saw that, we recognised that infrastructure, about $30 billion is going into the region, both from an infrastructure and employment sector. Strategic location, what's important for a radiation oncology provider is to have a close proximity to a public hospital, another private facility and a university, as well as Ingham Institute. So that was a big thing for us. And the community collaboration. What's more important for us is that engagement with doctors. So we can't provide optimal care without our partnership with our doctors. Our doctors are our biggest, it's our biggest client if we think about it from a private health sector. So for us, it was a relationship with the local health district, and that was, for us, it was important. How do we make sure we provide the best care by making sure our doctors are happy?
So Genesis Care were actually the group that spearheaded the process around site selection in Campbelltown. They made the decision, as Kathy mentioned, in collaboration with their doctors around where they wanted to be, and had approached council about the site that was up on screen. Council owned that land. It's about 3 hectare site in the middle of Campbelltown. And essentially, so this is just a little bit about the partnership model and a bit of a diagram to explain it. But ultimately, council were looking for someone to come in not to just deliver the cancer centre. They wanted someone to deliver the whole 3 hectare site into a health and education precinct. So for council to come to the party on the land, that was their sort of criteria. And that's where Northwest comes in. Genesis Care, being a cancer care provider, were sort of trying out a different model in terms of developing the cancer centre for themselves, but certainly didn't have it's not their day-to-day business in terms of developing health precincts. So they went to market to find a partner that is interested in healthcare investment and development. We were part of that market-led process and ultimately successful. So Northwest, just to give everyone just a little brief summary, we're a global healthcare investor, developer and manager, Canadian-based, but quite a substantial presence in ANZ. And healthcare is our day-to-day bread and butter. We don't diversify and do other things. It's not a diversification for us. So ultimately, I think Campbelltown Council and Genesis Care saw the expertise in health in Northwest to deliver on that commitment to develop a health and education precinct on the site. So just to explain that diagram in slightly more detail, so Campbelltown Council, landowner, developer is, for the first stage of the precinct, was Genesis Care. Essentially, Northwest came in to fund the development for Genesis Care. And then once the building was built, Genesis Care is the anchor tenant in the building, and Northwest is the landlord for the asset. In terms of the balance of the site, Northwest assumes the master developer role. And once those stages are built, we just have tenants anchoring and occupying the building. I think the reason why this is unique, PPPs aren't unique, but it is in the context of local government being the partner. Typically PPPs with state government or federal government, Campbelltown Council really welcomed the innovative approach and have been incredible in the process and great partners as well. So just to give you a bit more context about the precinct, and then we'll dive into the cancer centre. So as I mentioned, it's a circa 3 hectare site. Stage 1 being the cancer centre, that's built, it's operational, it opened in March. And similar to the Lyle McEwen Hospital discussed earlier, it finished ahead of program and under budget. So it's a fantastic news story. The second stage is the building with the sort of blue halo around it. And that's a short stay surgical hospital anchored by Ramsay Healthcare, and what we term as a medical office building. So GP, primary health, allied care, diagnostic kind of services, education uses, really quite flexible in terms of tenant mix, but with that health education lens. And then we have the ability to deliver around 15,000 square metres of added GBA on that precinct, with the other 3 buildings as subsequent stages. So it's ultimately around a 10+ year build, and we're excited. We'll forecasting commencing construction on stage 2 in mid next year. I think I won't labour the precinct too much, but what I really wanted to point out as another differentiator for the precinct is ultimately that it's a bit of an Australia first, in the sense that this precinct is anchored by private healthcare. Typically, you'll see precincts anchored by public hospital, a university. It's unique in that sense, and we've put a lot of focus into bringing in tier 1 operators into this precinct, and looking at how we can leverage the health services in the area and enhance the offering. And I think, you know, that's exemplified with what Genesis Care Service offering is, really complementing what's happening in the public hospital. Bringing in the surgical hospital next door will complement and enhance the offering in the cancer centre, and we're really building on that ecosystem, one step at a time, or one tenant at a time.
So with GC, when I got involved in it, we basically wanted to future-proof our, the design of this building. So, right now I can officially say that, we're already at almost capacity of what we, first envisioned to be at 18-month mark. So what we've done is we have a medical oncology department, which has 9 chairs and 2 treatment couches. And that allows us also for theranostic services. We have 12 consulting suites, which will facilitate medical oncology, hematology, and it's a great, it's great to be able to, add this to what's already provided, which is a strong service in a public hospital. And it's unique to be able to do this in a private setting as well, in a cost-effective way. We also have the radiation oncology department is fitted with 2 bunkers, and they're both neutral designs. So with radiation oncology departments, we have 2 main vendors. We've got Electa and Varian, and at the moment we're fitted with Electa, but the other bunker is not fitted, but it's ready to actually, with advancements in technologies, and we've already seen so many changes this year with Medicare. We can fit that bunker in next year with a new machine. And, in New South Wales, we only have 1 MR Linux. So we're ready for that future proof of that design.
And it's brand agnostic, which gives you flexibility.
The other thing is we also have pharmacy on site for our patients, and they're just for our patients. We have medical imaging, which is, Loomis designed, and we've got pathology. We've just gone live with clinical trials, and GC has 1,600 patients enrolled in clinical trials across Australia. That was really specific to our doctors and what our doctors needed. So when we think about, service offering with our doctors and what we need, it's not just what GC want to do, and each of our centres across Australia, we have 50 centres, each of them are designed differently, and it's based around what our doctors want. The biggest thing for our doctors was access to, pathology on site, because the patients wanting, we call it a one-stop shop for our patients, We want our patients to be able to get a blood test to make sure their blood count's ready in a private setting. They can, if they need bloods, they can get that. So that was really important. One of the biggest things for us is trying to make sure that, access for care. At the moment, we talk about wait lists, and it's very common, but with our patients, we ensure that we don't have wait lists. when we think of the design, we want to make sure that we've provided a calm environment for our patients. So those that are coming tomorrow on site will see the flow of that patient. We talk about wait times for our patient in the department. We don't want our patients waiting more than 2 minutes. That is incredible for a private or for any radiation oncology service. So, and you'll see that in the design. You come into the waiting room, the patients, it's a different setting. It's a comfortable, calming environment. It doesn't actually look like a radiation oncologist environment or an integrated centre. But then you walk into the clinical area and it's, you're greeted by a tree of life, which is where patients, mark a message on for us and talk about their care. So that's really crucial. And that all comes from patient feedback from our settings and from our, from our doctor feedback.
Kathy and I were laughing about that just earlier because as the landlord, we want to see that the centre's doing well and it's busy and lots of patient uptake. And at one point I had to ask the question, are you guys getting, the throughput? Is it busy? It looks very quiet in the building every time I walk through, but that's the 2 minute, from when you walk in to when you're in the bunker receiving treatment, and a real testament to GC and the way they operate.
And it's a testament to the doctors because I basically was saying like medical oncology, we're already busier than one of our sites that's been open for 10 years. So that is true. It shows you true partnership with the local health district, and that's why it's so important to engage them from the very beginning.
So I think maybe the other special part of this building is the sustainability features. And at a precinct, we've taken quite a sort of substantial stake in the sustainability perspective at a precinct level, but then also at the individual asset level as well. So at a precinct level, it's an Australia first in terms of the actual health precinct has been registered with Green Building Council Australia's communities rating tool. So we're really excited about that achievement, and we've got a long journey ahead on that, but it was great to sort of make that commitment. The building for stage 1 is targeting 6-star Green Star. So it's finished, but we're just currently going through the certification process at the moment, and that's under the as-built ratings tool. And then the second stage is targeting 5-star Green Star, but on the new buildings rating tool. And for those that are familiar, that's kind of like the equivalent of the 6-star on the as-built ratings tool. So we're certainly taking a leading position on sustainability. In terms of the features specifically to this building, it's all electric, PV, quite standard, I guess, but ultimately 100% renewable energy. 95 or more than 95% of construction waste was recycled. Reuse of water, not only for the irrigation, but also in the toilets as well, which was fantastic. And one of the major outcomes of this project was the air tightness. And we spent quite a bit of time on that, and that was very much led by the builder and used a lot of the smarts from the builder. But ultimately, the results that we got were quite impressive in terms of comparing it to benchmark projects, substantially less air loss. And why that's important, it's an investment to do something like that, but why it's ultimately important as someone who's a long-term holder of the asset, you see returns in the life of the building, less strain on the air conditioning and the HVAC system, and it ultimately pays for itself. So we're really happy with that outcome. One thing I did want to actually mention just on Green Star was when Northwest was first involved in the project was targeting 5-star Green Star. And we collectively agreed that we would push ourselves to 6-star Green Star, and we did that without actually adding cost to projects. So I think that's a testament to all the stakeholders being quite reliant and coming together. Outcome, ultimately it led to a fantastic outcome pending certification from GBCA. That's good.